afternoon, Mr. O. My name is Melissa. I'm going to be your nurse practitioner student today. We're going to do some physical assessment, your abdomen. Going to be doing neurological system, sensory system, and your motor systems, okay? So we're going to begin the exam. By looking at your abdomen, I'm going to have you lay down on the examination table on your back. I'm going to begin the exam by assessing the skin and contour of the abdomen. Is it okay if I lift your shirt? Okay. The skin is normal for, the color is normal for ethnicity. The contour of the abdomen is normal. No apparent bulging. I don't observe any pulsations. No obvious sign of peristalsis. Okay? And then I'm going to just listen to your abdomen in the 4 quadrants. Positive normal active bowel sounds noted. Then I'm going to listen to the arteries in your abdomen, the aorta, the renal arteries, iliac arteries, and then would have listened to the femoral artery, but for this exam we're going to skip that today. Okay, so we're going to listen to the aorta. It's going to be in the upper area. Arteries. Okay. No bruise heard in the arteries. Okay. Next we're gonna percuss the abdomen. This here. Normal sound, stillness heard. Okay, you're going to just palpate and light palpation. Okay, and then I'm going to do some deep palpation. Just tell me if you feel any discomfort as I do this. Good. Everything feels good. And then we're going to assess lymphatic inflammation. So when I press down, just tell me if you feel any pain when I remove my hand, okay? Okay?
No.
Good. Okay, the next thing we're going to assess for Murphy's sign. The liver. Just push down. Good. No pain. Wait, did you feel pain?
No.
Okay. We're going to assess Robin's sign, Repsing sign, negative. Okay, you can cover your abdomen now. The next thing I'm going to do, I'm going to lift your leg, and I'm going to pull your leg this way, and let me know if you feel any pain when I pull your leg. And this is assessing source sign. You feel any pain?
No.
Actually, I'm gonna just ask you to lay on your left side for me when I do
Right
this.
side?
Yeah, on your right side is fine. Okay, and then now let me know. Put your legs straight, and then tell me if you feel any pain when I do that.
No.
Okay. The next thing, lay on your back. So that was the soul sign. And then the next, I'm just gonna lift your leg, bend your knee, and let me know if you feel any pain when I do that.
No.
Okay, and that's the obturator sign, negative. Okay. So now, gonna do this test for cutaneous hyperesthesia. So if I pinch your skin, let me know if you feel any pain there. No? Okay? All right. We're going to go back to your abdomen. We're going to look, percuss the liver. Sounds normal. Percuss this a little lower. Okay. I'm just going to palpate again. Liver borders felt, no masses, normal size liver. I'm going to assess the spleen. Normal size spleen, no masses felt there. Okay. And we're going to percuss over the liver as well, the spleen. Okay. And then I'm going to have you turn, you can actually sit up on the side, and I'm going to, this is assessing the kidneys. And you're going to sit up straight. Right. I don't feel any pain when I palpate?
No.
Okay. Alright, so I'm going to be hitting over your the costovertebral angle, and you tell me if you feel any tenderness when I do this, okay?
Nope. Nope.
No? Okay. Everything looks good there. And I'm gonna have you lay back down. The last thing I'm gonna do is palpate for the width of the aorta, the aortic pulse. Okay. To the left of the belly button there, the umbilicus, you can feel pulsation. Alright. So we've completed the assessment of the abdomen. I'm going to move on to the nervous system. Okay? So you can sit up. You can actually, so sit on the side of the bed. Okay. So I'm going to ask you just some mental status question. It was feel weird for me to ask you this. Can you tell me what day is it today?
December 20th.
Okay. And year?
2021.
Okay. And can you tell me where you are?
Clinic.
Okay. And can you tell me why you're here?
For checkup.
Okay, good. And can you tell me who the president is?
Joe Biden.
Okay. Good. All right. Mental status patient alert and oriented ×4. All right. So I'm going to begin by assessing the cranial nerve 1. So I'm going to have you just close your eyes for me. I'm going to have you just first, before you do that, just you can open your eyes. Put one finger over one nostril and sniff. Okay. And then the other nostril. Okay. Actually turn. I'm going to actually have you sit on the chair. Yeah. Perfect. You can see. Perfect. Alright. Next, have you close your eyes. I'm going to give you some different things to smell, and you tell me what you smell, okay?
So.
Okay. Tell me what you smell now.
Alcohol.
Okay. Good. So olfactory nerve intact. And so now when I assess your eyes, I'm going to hold this card up. I'm going to have to read the last line.
LTFPH.
Perfect. 2020. Okay. Alright, so I'm just going to assess your pupils. Look straight ahead for me. Sit up straight. And then look straight ahead. Okay. Okay. Pupils normal size, reactive to light. And then I'm going to just bring this pen close to you. Just look straight ahead. Okay. And we're going to assess the fundus. Anything isn't working, but we would use the ophthalmoscope to take a look at the fundus and note any abnormalities, like any tick. Alright, so I'm going to ask you to do one thing for me. Have you cover one eye for me. Look directly ahead. And look directly ahead at my nose. And then you could tell me when you see my hand, okay?
Yeah. Can see it now.
So when you see it, just say now.
No. 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 No.
And then cover your other eye now. And look straight at my nose.
No. 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 No.
Can you tell me how many fingers I'm holding up?
Nope.
Tell me that.
2. 2. 2. You're supposed to keep staring.
No. Okay. Alright. I'm going to cover the other eye again. Let's do that again. Alright, so now just look straight at my nose and tell me how many fingers I'm holding up.
2. 2. 3.
Okay.
2.
Look straight at my nose. Don't look down.
2. 2.
Okay, good. Alright, that was assessing cranial nerve 2 and 3, the optic and the oculomotor. Okay. And I'm going to look straight at me at my nose. And I'm going to have you, when you're going to look at my hands with movement without moving your head. So look straight at me. And then okay. That's assessing the oculomotor central nerve. Okay. And then we're going to do a convergent test. So it'll look straight ahead. Look straight ahead at the curtain. And then look at this pen. Look at the curtain. Look at the pen. Alright, let's check convergence. Normal. Then assess central nerve 4, the trigeminal nerve. Alright, so I'm going to ask you to clench your teeth really tight for me. I'm just going to assess the teeth clenching. Alright. This is perfect. And then I'm going to ask you to... Alright, so before you do this, so this is dull and this is sharp. Okay? Alright, so close your eyes and tell me if you feel dull or sharp.
Do it again. Dull. Not heavy. Dull. Sharp. Sharp.
Okay.
You're not pushing hard enough. I can't feel it.
Okay.
Sharp. Dull. 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 Sharp.
Good. Alright. So I'm going to just look straight ahead. I'm just going to assess your corneal reflex. Good. Corneal reflex intact. We're going to assess facial nerve number 7, which is the facial nerve. Can you smile for me? Show your teeth. Okay. Raise your eyebrows. Okay. Frown. Puff out your cheeks. Perfect. Facial nerve intact. Now we're going to assess the vestibulocochlear or the optic nerve, which is cranial nerve number 12. Okay. So I'm just going to whisper something here. You tell me what you hear.
99. 99.
Okay. Alright, so I'm going to put this behind your ear. You hear the ring, you're going to compare the sound on both sides, okay? Here we go. Same on both sides?
Mm-hmm.
Okay. So tell me when it stops.
Stopped.
Tell me when it stops.
Stopped.
Okay. And then this. So that was the rhyme test. And tell me where you feel this, where you hear it.
Right here.
Yes.
In my forehead.
Okay. Do you hear? Okay, let's do it again. Do you hear it equally both ears?
Yeah.
Okay, good. And we're going to assess cranial nerve glostopharyngeal. So I'm going to ask you to say for me. I'm going to bring something to. All right, we're going to pretend that this is a tongue depressor. I'm going to say open wide and say ah. Good. And let me just need my pen to loosen. Okay. Good. And then yawn. Just try to yawn, right? Good. Normal movement of the soft palate. And I exercise for gag reflex. And then just, if you drink a little bit of water for me, I'm just going to assess so you swallow. Okay. Normal swallowing. Okay. And just speak for me or say anything.
Anything.
Good. It's fine. Alright, so we're going to assess the spinal accessory. The cranial nerve 11. So I'm going to shrug your shoulders for me. And then you're just try to prevent me from pushing your shoulders down. Okay, good. Good. Strengthen your shoulders. Put your hands out for me. Actually, no. So I'm gonna try to push your head. Just try to use your head to push away my hand. Push, push. Good. Same thing. Good. Good strength. All right, and that was assessing the spinal accessory. Okay, we're gonna test now the cranial nerve 12, which is the hypoglossal. So stick your tongue out for me. And then move your tongue from side to side. Good. Normal tongue movement. Symmetric. Noted atrophy. Perfect. So we just completed the assessment of the 12 cranial nerves. Next, we are going to assess the the motor system. Get my pinky together. All right. Okay. Next, I'm going to assess for muscle tone. Good. No atrophy noted. Good muscle tone. No wasting or muscle bulk, actually. Normal. Tone looks normal. Normal muscle tone noted. So we're going to be assessing the strength of your muscles. So I'm going to start with your hand. So you're going to put your hands out straight ahead like that. and then try to keep me from pushing it down. Good. Okay. And then turn over away. Try to keep me from pushing it up. Good job. Good strength in the arms. And then your hand like this, and then try to prevent me from pulling it. Good job. Same thing with that. And then for the wrist, try to prevent me from pushing it up. Bend. Good. Good job. Yeah. Next, I'm gonna grip my finger, and I'm gonna try to pull out of, grip it really tight, and just prevent me from pulling my hand out. Good. Normal strength. Okay. So I'm going to test your muscles with your hands. So fan out your fingers like that. Okay. So like, yeah, and then try to prevent me from pushing your fingers back. Good. Good strength in the fingers. And the thumb. Try to sorry. So try to use your thumb to touch your pinky, like that. Yeah. And then try to prevent me. Hold your hand out like this. It's okay. Push down your thumb on me, and try to touch your pinky. Good. And then same thing. Try to touch your pinky. Good job. Good strength in your thumb. Thumb. Good strength. Thumb opposition. So this, for the rest of this, I just need you to be laying down. So you can just make your way over to the exam table again. And we're going to test to straighten your legs. So lift this leg up and try to stop me from pushing it down. Good. Let's try the other one. Try to stop me from. Good job. And you're going to try to close your leg against my hand. And then I'm going to try to open it. Good. And try to close it. Try to prevent me from open it, and try to prevent me from closing. Good hip strength. So I just tested the adduction of the hips. Okay. Alright, just gonna bend your knee, lift your leg up and bend, and then try to push against with your thigh. Good job. Okay. Push against with your thigh. Good job. Say 5 out of 5 strength there. And then with your I'm gonna try to prevent me from pushing against your feet. Push your feet away. Thing. Try to prevent me from pulling down. Try to prevent me from pulling down. Good job. Right. So I'll say strength 5 out of 5 in the extremities. Okay. So I'm going to ask you to press down like you're pressing on the gas pedal. Good. Yeah. Good job. And then I'm just going to do a testing. So try to push your big toe against my resistance. So here. Okay, good. Alright. And this one, just going to have you sit up on the edge of the bed here. Okay. And then we're going to be assessing for coordination. So on your leg, I'm going to have you just alternate forth like that on your leg. Okay? As fast as you can. Good. Coordination is good. So I'm going to hold finger up and try to go from my finger to your nose as fast as you can. Okay?
Mike, what do you think?
So you're going to touch my finger and touch your nose as fast as you can. Good job. I'm just going to assess your gait. I'm going to ask you to walk from there and out the door and come back normal, how you would normally walk. Okay. Good. Thank you. gait is normal. And then you're going to do this actually the same thing. The next thing you're going to walk on the tip of your toes, like that. Okay. And the next one you're going to walk on your heels. Good. So the next thing I have to do is you're going to have you stand up. You're going to stand up for me. You're going to stand with your hands by your side, with your eyes closed, and we're going to look for any swaying. Good. Rumbar test is normal. And then the next one, I'm going to ask you, you're going to do the same thing, but this time you're going to stand with your palms up, straight out, your hand straight, elbows not bent. Yep, perfect. Eyes closed. And that's the pronator drift. Negative for any pronator drift. Good. And then last thing, you're going to have you sit in this chair. I'm just going to observe how you stand up. And then stand. It's good. That was normal. Thank you. Okay. You can have a seat back on the chair. So next we're going to do the sensory assessment. Okay? Because this one is actually easier if you're laying back on the bed for me. Sorry. A lot of moving.
Okay.
Alright. Okay. So I'm gonna just be assessing pain and light touch sensation. Like I was saying, so this is sharp, this is dull, okay? And so tell me when you feel sharp, when you feel dull.
Close my eyes.
Yeah, close your eyes. And go ahead.
Sharp. Dull. Dull. Sharp.
Okay.
Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull.
Okay. And with this one, now I'm just gonna tell me, I'm gonna assess for, yeah, just let me know if there's a difference in the strength of the sensation, so like that. Yeah. Okay?
Okay.
Strong.
Yeah.
Okay.
Okay.
Strong. Sharper.
A little bit.
Okay.
Yep. Still going stronger.
Okay.
Less strong. Less strong.
Okay. I'm just gonna take your socks off because it's easier for this one. And I'm gonna move your big toe. You can tell me if it's pointing in or out, or up or down, okay?
Okay. Up. Down. To the right.
Mm-hmm.
To the left.
Mm-hmm.
Up. To the left. To the right. Down. Up.
Good. Position, sense, and back. So I'm going to put an object in your hand. If your eye's still closed, just tell me what it is, okay?
Pen.
I'm going to write something in your hand and you're going to tell me what it is, okay?
Squiggle. Circle.
Okay, it's going to be a number.
8.
Okay, yeah, that was 8. Okay, tell me what this is.
3.
Yeah, that was 3. Okay. So I'm going to touch you with, so this is 1 point. So you're going to tell me if I'm touching 1 point or you feel 2 points at the same time. Okay?
1. 2. 2. 1. 2. 1. 2. 1.
Okay, good. Okay, and have you sit up. Okay. And I'm going to close your eyes. And I'm going to touch you someplace, and you're going to open your eyes and point to where I touched you, okay? Good. And that's extinction. Perfect. And for the last part of the exam, I'm going to assess for deep tendon reflexes. Alright, so we're going to be assessing the bicep reflex. Bend the elbow. Perfect. Normal reflex, and we're going to assess the tricep next. Still. Okay. And we're going to test the popliteal reflex. Normal reflex in the ankle. And we're going to assess the plantar reflex. Babinski, normal. Normal. Okay. Okay. I think we've covered everything. Just gonna take a quick look to make sure we didn't miss anything. So we completed the abdominal assessment. We did the motor, sensory, and deep tendon reflexes. And gait and stance. Okay, well thank you Mr. O for being here today and coming in for your exam. And I look forward to seeing you soon.